I'd like to give our panelists, first of all, 2 minutes to outline their position on long COVID, and then we can proceed to questions. Okay, would you like to start and give us a short outline of where your party stands on long COVID?
Well, thank you very much indeed, Jane. It's lovely to be here. I'm just saddened that we're not joined by other representatives of other parties. My name is Alex Cole-Hamilton. I'm the leader of the Scottish Liberal Democrats. I'm known to some of you. Some of you are my friends. I hope to become friends with the rest of you over time. I hope that you will have seen the work I have been doing on long COVID. I think it's fair to say that particularly Jackie, Sandesh and myself have all been relentlessly trying to fight your corner in a parliament or against a government that I don't believe is listening. And that is self-evident in the fact that I'm sitting in my home today because I left Parliament after FMQs to come and do some work in campaigning in other parts of Edinburgh, because I frankly wasn't going to sit through a sort of a debate that the government pulled out of the air at the last minute to make way for the long COVID debate that should have happened this afternoon. I was scandalized by that. It was my party's business day yesterday. Everyone knows the Liberal Democrats are a small party. We are growing, but we are small. That means we only get one business day a year. And it was only because the government had scheduled a long COVID debate for today that we didn't schedule one for yesterday. Had we known that they were going to cancel it, we almost certainly would have done so. And why? Well, we know that long COVID, as of today, affects at least 132,000 Scots. Those are people who've been diagnosed with the condition. But we're certain there are a lot more out there who are perhaps as yet undiagnosed. And certainly there are more to come as the Omicron surge continues to bite, and we see record levels in our communities. So this is a massive problem. It's an existential problem for things like the NHS, for workforce planning, for how we deliver our social security benefits, because this is going to stay with us for some time to come. Nobody knows how long long COVID lasts, unless it perhaps potentially in some cases might last in perpetuity. My journey in this environment, in this issue, really started with Stuart McIver, who's on the call this afternoon. And if I think back, I actually did know several long COVID patients before Stuart and I met, but I'm not sure they knew they had it. I didn't know they had it. They just hadn't got over COVID, but they were several months into their journey. And it was really Stuart's sort of tutelage that let me realize what a horrific and debilitating condition this is. You know, I'd never heard of words like air hunger before. I didn't understand that, you know, the remnants of a virus that had long since left your body could still cause you crippling diarrhea, muscle spasms, the sort of neurological side effects that we now know is associated with long COVID, and a basket of perhaps 160 different symptoms, one of which can affect sufferers at any one time. I didn't really understand that sometimes it's a remitting condition, sometimes it's chronic, and it affects people in different ways. There's still so much we don't know about it. That's why Jackie and I and Sandesh very early on, when Parliament reconvened after the summer recess, agreed that we would establish the cross-party group on long COVID. We would try and drive for things like research and investment, but also pointing to success where we know other jurisdictions are doing more, particularly in England, where they have long COVID clinics, where they have access to hydrotherapy, where there is a care pathway through Imperial College, none of which exists in Scotland. Now, the SNP were quick to talk about creating a strategy and a pathway, and well, they produced a very fine-looking piece of paper, and I think it was at £20 million, none of which has yet been spent. We know through FOI that this money that was announced to great fanfare in September has not been spent. That, I think, is the totality of what you need to understand about the SNP's commitment to this issue. And I thought it was quite astonishing when I think it was it was Stephen Kerr last night challenging the business change, when we had MSPs from the SNP saying, I've got long COVID, I'm doing fine, or I'm being treated. Well, I'm sorry, but they don't speak for the population of long COVID sufferers in this country. They don't understand what it's like to not know whether you're going to be able to sustain your employment, or what it's like to lose your employment because of this condition. We need to think about this very differently. We need to recognize this may be the biggest mass disabling event since the end of the First World War, and we need to treat it accordingly. I don't think we're doing that. Liberal Democrats have got your back, but we want to strip the party politics out of this, and we want to work with our partners. That's why I'm delighted to see Jackie here. I know Sandesh would be here, but I am dismayed to see no government members here, either from the SNP or the Greens. So I'm looking forward to your questions. Thank you.
Thank you, Alec. Good start. Okay, Jackie, would you like to build on that?
No problem. Can I start by saying how delighted I am to be one of the conveners of the cross-party group on long COVID, along with Alex and Sandesh. And let me say to you, we do work in a cross-party way. We tend to hunt as a pack when we think things are wrong and need to be put right. But the purpose of tonight is for you to hear from us individually about what our parties think. Let me, play my get out of jail card quickly, because the reality is a lot of the stuff I want to talk to you about is health related and employment related, and it's not necessarily directly the responsibility of local government. But let me tell you that when you're electing councillors, one of them from each local authority will be appointed to your health board. At least half a dozen of them will be appointed to your health and social care partnership. So they will have influence over issues that matter to you in terms of health. Now, the main issues that the Labour Party have focused on are, firstly, access to treatment, and whether that's long COVID clinics or whether it's defined clinical pathways. I would rather have both. Where you have defined clinical pathways available at a local level close to home, but you also have the opportunity for specialist clinics in a couple of health board areas that people can travel to where it is required. At the moment, we have nothing. The £10 million announced 7-8 months ago, not a penny of which has been spent. Meanwhile, more and more people are getting long COVID. The second area that we would focus on is support and rehabilitation. For a lot of people, going through a medicalized process is important to understand what treatment is available, but actually building up your strength and resilience again is something that can be done both by the NHS in terms of primary care and also by local government with access to leisure services and opportunities there. So we need to create a package and conditions where people can access both the treatment and the support and rehabilitation. And the final area I want to focus on is employment. Now, some of us had a very interesting meeting this morning with the minister who's responsible for employment, Richard Lochhead, and I have to say to you, I came away slightly depressed, not much, but slightly so, because we all know that there is a Fair Work statement for COVID. My fear, based on the conversation, is that is likely to be reviewed and ended. And what we asked for and what we would bring forward in my party is a Fair Work statement for long COVID, because I think employers are grappling with what this means for them. If you're in a larger business, a big multinational, they maybe have occupational health, they maybe get this and want to help people in their journey back to work. But in areas of the private sector, particularly small businesses, and indeed in some parts of the public sector, there is no such understanding, and people are being pushed to go back to work when they're simply not ready to. Losing people with long COVID from the workforce loses experience and talent, and actually employers should understand and recognise this. So one thing that I suggested to the minister that certainly is in the Labour Party's view a good policy is having some kind of central occupational health unit that small businesses could draw on to assist them in dealing with long COVID in the workplace. I will stop there. That's a whistle-stop tour of what we would do. But my one plea is, I've seen in the past with ME, people abandoned, people being told it's not really a condition, and having to wait ages for recognition and for support. We cannot let that happen with long COVID. So I, and indeed all my colleagues in the opposition, will keep the pressure up. Thanks very much.